It's Dr. Irene here, and I'm here with Jaime.
Hi.
Allen used to be my trainee, and she was also my associate at Hillside Wellness Center. So she's in private practice in West LA. She specializes in healing trauma, rape, and assault, and she works with a lot of women and women's struggles. So hi, Jaime. Nice to have you today.
Thank you. I'm glad to be here.
So today we are going to be talking about spirituality and how we incorporate spirituality into a session. And we've come up with 5 ways, so we'll kind of go back and forth. Jaime incorporates a lot of astrology into the work that she does, which I think is really fascinating. And it brings a really a different component into therapy. I'm sure your patients, are super excited to come and ask you what's going to happen in the future. I know that the work that you do, being your supervisor in the past, I saw you really incorporate a lot of spirituality into your sessions, which I really appreciated because that's one of the things that we encourage at Hillside. So how do you bring in the patient's own spirituality into session, and how do you keep yours kind of out of it?
Definitely, because that is a very, it can be a problem area if it's not done delicately, because everybody has their own different version of spirituality. Even if you're like a traditional Christian or, traditionally Jewish, or if you have like a traditional religion, that will still vary so much person by person. So I do try to assess what the patient's own spirituality is first, and then assess if they are interested or open to metaphysics, or if they are in that as well. Then I try to incorporate using that in the session, just kind of like when it comes up, or they may ask, usually when they have crises in their life, or they have particular times when they feel lost, they want guidance. And then we can use astrology, as you were saying. We can use these different metaphysical tools that we have that we'll get into. And I found it's really helpful.
Yeah, I think that as a therapist, we have our own beliefs and we have our own thoughts, and whether we're connected spiritually or religiously, which those two things are different. We can discuss that very briefly later on, but I think one of the important things is really separating ourselves and our own beliefs from the patient in front of us, because it's not about us. So how do you do that? Because you are a very spiritual person, and the therapy that you do, you incorporate that so much, I can't ever see you doing therapy without that component. So how do you set that boundary?
Yeah, because that's actually even something that we talked about together as I started working for Hillside, because I have a background in astrology, and that's how I got into therapy. Was I wanted to help find deeper ways of having people heal instead of using astrology or psychic readings as a crutch, as like an Ativan or like an anti-anxiety medication, which is where I saw it being used a lot in the metaphysical community. First, I try to have them work through a lot of their emotions in the first half of the session completely without it, just with different coping skills or processing their traumas. And then more towards the middle and end of the session is where I would want to go more into maybe using a tool like using the cards or using the astrology, because I don't want them to rely on that as like an anti-anxiety medication as a crutch. So first I want them to really do the work, and then we can use that as a tool to kind of reinforce what we've been processing in the sessions as well, and then leaving time to process even that before the session ends.
I guess what you're trying to really say is you're trying not to get them too dependent on external.
Yes. Absolutely. Yeah.
Okay. So the another way we have learned that we both work the same way is we like these cards, and
yes,
know about these cards. They're actually pretty amazing. There's another one, and they're just called angel cards, and it's just like guidance cards. You can just pick one and it tells you like what to focus on. These helped me a lot, but when I found these, I think it was you or someone else who told me about this, and I was like, oh, what is that? And these are really cool because they're specifically for therapy, and I think they're so cute. So it comes with a little book, and then it comes with these cards. And so what's cool, it's like really gold. I love gold. And you can just kind of, whether it is you're mixing it and you're just kind of like thinking about something, or I like to always leave these cards outside just for my patients to just kind of see. And sometimes when they're just lost, because sometimes when you come into therapy, you're like, I don't know what I want to talk about, and I'll say, okay, well, just kind of talk, like wherever you're at. And if they can't, then they'll say, oh, can I pick a card? And so, for instance, let's say I picked this one. So visualize success. Oh, very interesting. So see yourself doing well in the situation, have faith in a positive outcome. It gives you a little, a title of what the card is, and then also gives you a little bit of a writing of like what to focus on, which is really cool. And then in the book, it gives you a little bit more of how you can actually bring this into therapy. So for instance, you can really use these cards with anybody, because everybody that I know, and there isn't one person that isn't trying to visualize their life being different. So maybe they weren't thinking about it during that time, but once you pick the card, it brings something up. Then from this, you kind of start this whole conversation. I think a lot of times, I don't know if you've seen this, Jamie, but I know a lot of times if I'm working with people who are super religious, or who are not, and the minute I bring up angel cards, they'll say, oh, well, I'm not religious, that's against, or if they are, like, that's against, but has no religion attached to it whatsoever. So I think two of the main things we like to keep out of session, meaning our own personal views of religion and politics. We want the patients to talk about it, but we don't talk about it ourselves because there's no point for us to express our political or religious views. But just to know that, you can bring spirituality and leave out the religion, because religion is much different than spirituality when it comes to, religion is more talking about the rituals that you do and the beliefs that you have, whereas spirituality is something more external, more connecting with yourself in a higher power, per se.
Yeah. And I've noticed that a lot of people in session, I heard a lot of times that they say, oh, I went to therapy, but I feel like it's not that effective because all I do is just listen, and so sometimes people are really looking for more of a directive session. So I like how those cards also have a lot of therapy interventions. And so if they want homework, or if they want something to do, or because I've noticed sometimes people, if they are trying to strengthen their own self-esteem, they won't be able to be very self-directive. So this is a good kind of helping stepping stone for them to be able to get into their own kind of sense of agency. So I feel like these cards are really good with giving them an activity to do, and that will start to get the ball rolling for them.
And then also the regular angel cards, which are just guidance cards. So I love them.
Yeah, they usually come up to kind of reinforce what you've been talking about in session. It's really funny how it coincides.
It's amazing. When I was going through a really tough time in my life, I use those cards often, because that's one of the things that, you want when you're feeling depressed or anxious. The one thing you want is answers.
Yes.
And so with the cards, I would just say, okay, well, I can't get an answer from anybody or the universe, so I guess these cards, and they literally helped me throughout the time, because it would give me something to focus on for the day, and I would have it, and I was just like, okay, so this is something I could focus on. It just gave me something to look forward to. Tell us about how you incorporate astrology, and if someone was to go to therapy with a therapist who incorporates tarot reading and astrology, what the boundaries should be, and how you incorporate it to actually be therapeutic rather than telling the future.
So it's twofold. One, because I am an astrologer, it helps me as a therapist to know somebody's chart. Because for me, it helps me be able to know how to communicate to that person. What is their personality like? What are they most responsive to? Where are they going to be triggered? Where are their growth areas? So it really helps me as a clinician help. And then if they want to know themselves about themselves and the people in their life, then that is a tool to help kind of give them more insight to who they are as a person, and to improve like relationship dynamics in their families, as well as like with love, with romantic love. So and even with their children, it really helps in that way. So if you have a particular sign and you're dating somebody with a sign is different, then you'll be able to kind of, it's like love languages. It lets you kind of bridge a gap to learn how to communicate to that person better, or understand and know like they're not really trying to disrespect you. They just have this personality, which is different than your personality. I feel like it connects to like a Jungian way.
Yeah, absolutely. I think as a therapist, there's no way, you don't learn how to be a therapist by reading a book.
Right.
And I say that, to my students. I say, there's no book that's going to teach you how to be a therapist. You truly have to be able to get what you have learned and apply it from your heart, and truly become curious about the person in front of you, and put yourself aside and just learn about the person in front of you. And without theory, You know, it's hard to develop a story about this person and how they've become who they've become. So, using Jungian archetypes, which is the next one, the one that I use. You have the cards, by the way. Mine is.
You have the cards.
Yes, I love those cards. And those cards, I think, you can, if your therapist practices any kind of, Jungian psychoanalysis, they're really cool because, I mean, you can buy them and do them yourself, but it's really nice to have something, a trained professional kind of guide you through it. I'll usually have, I'll give them the cards and I'll play music and they'll do a short meditation, and I'll have them really go through all of the cards and pick out 14 cards that they connect with, and then those 14 cards every day for the next 14 sessions, we pick one card and we break it down and we see what part of them that card is. The cards themselves, could you show us one of the cards?
Yes. So I really like these two particular cards, really stood out to me. So this one is the Lover, and it shows the light attributes and the shadow attributes. So it'll show the positive qualities that you're experiencing right now or that are, in your personality, and then the problem areas or the areas that are challenging. I also like this one, the Rescuer. This happens a lot where people, they want to save everybody because you're such a good person, but then there's a double-edged sword and there's a drawback to that too. So I like these two cards especially. These came up today.
Hold it up for 1 minute. So basically, when a patient looks at the cards, you could see the light attribute and the shadow. It doesn't mean that the shadow is the bad side or the negative side. It's really just it's the darker side. It's the side that a lot of people don't show. You can put it down. It's okay. Thank you.
Sure.
If someone is a caregiver, if you're a caregiver, that's one of your archetypes. Is you are a caregiver, your light attribute would be you take care of everybody, and your shadow is this hidden part of you, this darker side of you that follows you everywhere you go, and you secretly want people to take care of you, but when somebody does take care of you, you don't know how to take it in. You almost kind of, no, it's my job to take care. So it's like this struggle that you go back and forth within yourself. And so learning about your shadow is the most important thing you can possibly do in therapy.
Yeah, I think so too. Mm-hmm.
It's something that follows you and it kind of haunts you in a way. Know that you don't let a lot of people, because a caretaker, you would rarely see them say yeah, I want you to take care of me, I want you to do this for me, and it's not something that they would naturally do. And to teach a caretaker to allow someone else to take care of them is quite magical. Yeah. Okay, and lastly, we both use a lot of mindfulness in our sessions. I love to use guided meditation. I have so many ways, and using family systems, specifically Satir. I taught you guys how to do the parts party. I think is a very, very beautiful thing to do in session.
A really beautiful meditation that's spiritual is a candle meditation. It gives them something to focus on. Sometimes when you do a meditation, it's too abstract and it's difficult to still your racing thoughts. But if you light a candle, especially if you use the candle to pray or to manifest something or bring something in, it's something where you can focus. It grounds your attention and energy. And then also it gives you hope that something will happen from it, or that you'll get a response to your prayer or to your manifestation.
Oh my God, that's so nice. Now, what do you think about, I've heard from a lot of people who practice astrology and that also do therapy, is they pick certain colors for candles. Does that matter? Does the color of the candle actually matter as to what your intention is?
It's so interesting because I feel like there's a lot of debate about ritual, about, what are the specific herbs you use? What are the specific colors you use, the oils you use? I mean, to me, I'm not really fixated on rituals. I think that if you want to pick a different color, be creative, be free-spirited with it. I think whatever makes you feel good is going to be what resonates with your heart. So there are set colors that go with different categories, but honestly, I think just pick what you want.
Okay, well, I think that's it. Thank you. I really appreciate you taking time out of your busy schedule. I know how important therapy is nowadays, especially with everyone's anxiety and fear for the future and depression levels and so forth. Thank you for taking time out of your day, and I'll see you soon. Thank you, Jaime.
Thank you so much. Bye.